how you can manage these concepts, which are very difficult. So, can people just shout out, I don't care if you all shout out at once, but just shout out some names of ideally living, doesn't have to be, some great medical leaders, people who you really admire. They can be presidents of royal colleges, they can be people you work with. Give me some names of people you admire. Ideally people that I might know, so we can have a little think about what makes them inspirational or good in your mind. Again, louder.
Atul Gawande.
Okay. Yeah. Atul.
Pauline Kumar.
Yeah.
Claire Lemur.
Any others?
Bruce Keogh.
Bruce Keogh. Okay. So those are four. I'm very pleased there were lots of women in there. That's very exciting. So those were four very different people who, most of whom I've had the privilege to spend a little bit of time with. And I want you to think about, in your mind, you don't necessarily have to have spent time with them, but what are the qualities, what are some of the things that made you shout out their name? So Deborah, why did you choose Claire Lemer?
I suppose that she's a woman, and it's impressive that a woman would be head of the RCGP.
Yeah. Okay. So who shouted out Gawande? What inspired you about Atul?
His reading, his books, and he's behind the suitable checklist.
Yeah. So Atul is an endocrine surgeon in Boston who has spent a lot of time thinking about public health and how you can change the practice of medicine and make it safer. And one of the many things he's done is the WHO checklist. Okay, you mentioned...
Yeah, Prof. Kumar, just because she's obviously very high flying in her own field and the society, but the way that she relates to you when you're like right at the bottom of the pile, right from, when you're starting out, she just seemed to me have a good way of trying to engage you with the tasks, not just in just what you're studying in a lecture, but just for the whole profession.
Okay. And why did you choose Bruce?
I think he has a great sense of what the right thing to do is. And even though he's got so many competing interests being pulled around politically and by his sort of loyalty to clinicians, he seems to keep his eye on what's the right thing to do, and that's an amazingly difficult task.
So each of you chose very different qualities, and you're obviously very different people that you find inspirational. And I guess that's really my first reflection, and it's something that Aidan said really powerfully earlier, which is that there's no one style of leadership that is the best way to be. And the most important thing to be is to be true to yourself. And that means to find where your strengths are, whether it's through some kind of training in a leadership academy, if you're lucky enough to do that, or if it's in your everyday practice. But what is absolutely crucial if you want to take on roles that are challenging is that you understand your strengths and your weaknesses and you play to them. You don't follow someone and think that the only route to do that is to be... Claire Lemer can be very dynamic, she's very strong, she's a brilliant speaker. Parveen is different, she's very much a people person. So you have to find what's important to you and be true to that, because otherwise it's very challenging to be a good leader. That's my first reflection. So, how many of you think that at some point in the future you want to hold what we would call a formal medical leadership role? So whether that's being a clinical director or something like that. How many of you are already thinking about that? Is that why you're here today? Hands up, maybe thinking? Okay, first of all, I think that's absolutely fantastic, because if you'd have asked me when I was a medical student, I would have A, been hiding under the table at the thought that you might force me to do that, and B, I probably wouldn't have known what those roles were, so I think that's completely fantastic. So I've got a next question for those of you who are brave enough to stick your hand up. Why do you want to do it? Someone want to say? What is it that makes you want to think about those kinds of very formal roles? I saw some hands up there. What is it that made you want to?
Well, and from my experience, people that I've met who are in these leadership roles very often have come up with ideas that have streamlined or, in some cases, revolutionised the way that patients have been dealt with. Two specific examples I think of is a colorectal surgeon and an HIV professor who really changed the way the patients interact with and the quality of the patient service. So it's really, I suppose that's the crux, is just making the system better, or having an opportunity to make the system better.
Yeah. Anyone else want to be brave and say why they stuck their hand up and are thinking about a formal medical leadership role, something like that? Thoughts? Okay, so I completely agree. I think the only reason to take take on a leadership role, whether it's formal or informal, is because you are passionate about getting something done. Because you really have a problem that you want to change, that you have an issue that you want to get to grips with, that you have something that drives you. I do not think stepping into a leadership role, because it is glamorous, because you think the pay is better, because you think people will admire you, is a good reason to do it. And I'll tell you why. I think it's because my reflections on watching senior medical leaders at work, and I'll explain a little bit what I've done during my career and why I've had the privilege of doing that, is that leadership is blooming hard. It's really challenging. It's really lonely sometimes. And as Aidan says, sometimes you make really difficult decisions and you don't make the right ones and you have to live with yourself. And I think the only thing that can keep you going when things get tough is because the reason you're doing it is because there is something so important to you that you can get up the next morning and keep going. If the only reason you're in that role is because it seems a little bit exciting, that's not going to sustain you through the difficult times. So the reason to lead, from my reflection, is because you're passionate about something. And I think that brings us on to a sort of sub-point of my second reflection. And really it's what Aidan was talking about mostly this evening, which is something I do not think we talk enough about in the NHS. And actually, post-Francis, I think we need to. And that's moral leadership. That's exactly what Aidan was talking about. I'm not talking about religious leadership, I'm talking about making really difficult, brave decisions and being able to follow through on things that a lot of us would find very challenging. And as Aidan said, when I look back, particularly at my very junior doctor years, there are things I wish I had done differently because I didn't have the courage to speak out or to behave in a way that I would now hopefully have the ability and know how to do. But I think you need to be aware that leadership is blooming difficult often, and that if you don't have a good cause that keeps you going, and you have the courage to do that, you're going to find it very challenging. So be yourself and lead because you're passionate about something. How many people have heard of Memorial Hospital in New Orleans? Anyone heard of Memorial Hospital? No? If you get the chance, there's a book that's just been published by a doctor actually. She spent a huge amount of time with physicians and with staff post-New Orleans. So we're talking about New Orleans after the big tragedy when there were a huge number of people trapped in a city that was buffeted by the elements. And Memorial Hospital was right in the centre, and for about 5 or 6 days had really no contact with the outside world. And so the clinicians there were having to make decisions. They were running out of supplies, they were running out of electricity, they had really seriously sick patients who they couldn't evacuate, and they were having to make very difficult decisions. And there were similar hospitals nearby who were in similar situations, but Memorial Hospital is notorious because the clinicians there made decisions which later led to some of them being accused of manslaughter and even murder. Because they decided that in the absence of resources, there were some occasions where it was in the best interest of their patients to commit what I think most of us would at best call euthanasia and at worst call murder. And they were really difficult decisions, and I'm not criticising them for what they did, but in those moments they made their choices, and in other hospitals in very similar situations people made other decisions. And it's been very difficult for clinicians in America, and cathartic in some ways, to address why it is that some people did some things and other people did others. And I'm hoping that no one ever has to be in a position where they have to do something like that. But I guess what I'm saying to you is that the decisions that we make every day, not necessarily in extreme situations, require moral courage and moral leadership, as Aidan pointed out. And I think it's really important that if you're going to step into leadership roles, you've thought about how you may address that, and you've really started to think where your values are and what matters to you. It's worth reading. Okay, so Aidan started to sort of ask this a little bit earlier, and I think George has taken it on one stage further, which is how many of you feel like leaders right now? How many of you as medical students or junior doctors, if I said to you, are you in a role where you're leading, would put your hand up? No? What about if I pushed you a little bit harder and said something outside of medicine? If you, I don't know, play football, or if you are part of an orchestra, anyone willing to stick their hand up and say that they're sort of in a leadership role? Okay, so why, when I said to you, are you in a leadership role the first time, did you not leap into thinking about things outside medicine? What was it that when I said a leadership role instantaneously grabbed you towards medicine? Like, because you thought that's what I'd be interested in? Go on.
I feel genuinely really trapped by the hierarchy.
Yeah.
Like what Ethan was saying earlier about physics and
Yeah.
consulting
and I think that's really brave. And I know that when I was the equivalent of an F1, I'm so ancient that we didn't have F1s, but when I was the equivalent of an F1, I felt exactly the same. And a lot of the decisions I made because in the back of my head was thinking, what would my consultant think of what my decision will be, not what is the right thing to do for that patient. And I think it's a huge problem in medicine, a really huge problem in medicine. How many of you know who Kate Granger is? Anyone know who Kate Granger is?
Gold medalist.
Yeah, there's that Kate Granger, but there's another. Go on.
She's dying of cancer. She's a junior medic, though.
Yeah, so she's a medical SBR. She's a geriatrician, and she writes a blog which I recommend you having a look at. And she's dying of cancer, and she talks very openly about her challenge that she faces and how she's been dealing with it. But she's also set up the most amazing campaign, which is called Hello, My Name Is. And in fact, it's been so successful that I think it's either this week or next week at the NHS Expo, she's going to be interviewed by the chief nurse of NHS England talking about My Name Is. Does anyone know what the campaign My Name Is? Go on, chat. Go on.
This is just the introduction thing,
Yeah.
and I think this wasn't actually a number of care providers to her. She didn't know what their name was.
Yeah. So she spent a lot of time in hospital, whether as an outpatient receiving chemotherapy or as an inpatient. And she just started to realise that people never said, hello, my name is Claire, or hello, my name is whatever. And they didn't treat her with the respect that I hope anyone would give a person. And so she started this campaign, particularly on Twitter, trying to encourage patients to ask for that, and also clinicians to feel like that's what's important to them. And she's a medical SPR in a relatively small hospital in the north of England. She is not in a position of authority in terms of hierarchy, and she probably has had one of the most significant effects on people in NHS England, particularly in the leadership, talking about what really matters and how to inspire people and how to make a difference. So my third reflection to you is I know that medicine is hierarchical, and there's a lot that we need to do to change that, but you do not have to feel like you're being squashed by that hierarchy. And actually there are amazing people out there like Kate who are saying and doing things from outside of positions of authority and making a real difference. So you can do it, you just have to be brave enough and have something that you really want to change. So I've talked a lot about sort of theories and concepts, and I said I don't feel that comfortable with theories and concepts, but those are 3 reflections. I thought I'd just tell you a little bit more about how I've got to do what I do now. And I thought if I was going to follow what I've been preaching at you, I should tell you what I'm passionate about and why I'm doing what I'm doing now. So what gets me up in the morning is trying to make a difference to the healthcare that we deliver to children and young people, particularly in my case to the children and young people of Southwark and Lambeth. And that sounds really idealistic and perhaps really sort of a bit motherhood and apple pie, but I genuinely mean that. Mostly because I cannot bear to watch care being done badly. It gets under my skin and it drives me bonkers. And so for me, it's a constant quest to think about how we can do things differently. So I spend 50% of my time delivering clinical care. So I do outpatient clinics, I do attending weeks, I do all the normal stuff that I do. And then I have the absolute privilege to spend the other half of my time doing 2 roles. One is a service transformation role, so finding the things that drive people bonkers and trying to change them and make them better. And 2, working on bringing together primary care and secondary care in Southwark and Lambeth so that the flow of patients is much better, so that patients don't have to tell their stories 25 times or go to 25 different people to get the care that they need, and so that professionals have the support and the networks that they require to do their job properly. That's what I do right now. I went to medical school, I did my clinical in London, and I was merrily going along the path I thought as a clinician. Probably if you'd asked me at medical school, I would have said I was going to be a paediatrician. And then I literally had an epiphany. And for me, that epiphany was one night on a neonatal unit where I was trying to prescribe potassium to a very sick baby. And I was scrawling down how much potassium to give, trying to work it out on the back of an envelope with probably a pencil. And every time I got halfway through the calculation, a bleep would go off or something would happen and I'd get distracted. And I remember sitting there and thinking, this is absolutely crazy. You can put people on the moon and I'm still doing calculations which could kill a baby, either because I overdosed them or underdosed them, with a piece of paper and a pen or a pencil. So I started to get interested in what I eventually discovered was patient safety, and that led me to spending a year in the States doing a policy fellowship, thinking about patient safety and quality and learning about those concepts. thinking, wow, I'm going to do all of these sorts of things, and actually realising I was coming back to be, by that point I was already a registrar. I was coming back to be a registrar at a small DGH, and actually what do people want me to do? They wanted me to do my own calls and be quiet and get on with life. And so I kept looking for things to try and kind of allow me to use those skills that I'd learned. And I ended up taking 3 further years out of medicine. I spent 2.5 years working at the Department of Health, doing public health and health policy, and then I spent a bit of time in the private sector as well, learning about how management consultancy works. So I've had a very varied career. And then I did the most challenging job I have ever done, because I was, I guess, prepared to say, these are the things that excite me, how can I actually live them in my day job? And so I spent 2.5 years working part-time as a clinician and part-time as an NHS manager. So I was running an ophthalmology service. I truly know absolutely nothing about ophthalmology, but I know more now than I did 5 years ago. Trying to take a service which had been failing and turn it around, and in fact get to the point where we were tendering and winning bids to provide services at other hospitals. It's one of the most difficult things I have ever done, but it was also one of the most joyous things I have ever done, because of much of what George was talking about, which is creating teams. I couldn't have done that. I don't know how to do ophthalmic surgery. I don't know how most of the machines that the nurses use in ophthalmic casualty or to do day-to-day test work. But harnessing that energy and enthusiasm and using it to change a service was completely inspirational and absolutely wonderful. And so that's how I've ended up doing the job that I do. Along the way, I felt a little bit less courageous than perhaps I should have done, and so I snuck out and did some degrees to kind of bolster my confidence and teach me some skills, but that's really what drove me to do what I do now. But I have been immensely lucky to do that, and I'm very aware that not everyone gets those opportunities, and that's why myself and a friend and colleague, who's actually a psychiatrist, set up something called Diagnosis. Anyone heard of Diagnosis? Wave your hand if you have. The best way if you want to get involved in that is through our LinkedIn group, so just search for us there. It is, as James said, a clinical leadership social enterprise, and the idea is that we try and allow people, particularly clinicians, the opportunity to challenge themselves and think about the bigger picture. So think about why the NHS is funded the way it is. Or we've had sessions on NHS strategy where we've had people from NHS England and from local organisations talk about strategy. We've had the head of IT for NHS England come and talk. We've had people from the private sector. We've had clinicians who've moved into IT come and talk. So we hold events about 2-3 times a year. They're very kindly sponsored, often by big private sector organisations. So you get nice champagne and nibbles. And the idea is to come and learn. But we also really encourage managers to come, senior, junior, and people from the private sector. So there's a real opportunity to mingle. It's great if you ever want to step outside healthcare and you want to go and do something different. It's a very good way to make contact. But it's also just really nice to see that actually what gets you up in the morning as a medical student or as a junior doctor is very similar to why a young manager or even a very senior manager goes about their job. So you're more than welcome to come and join that. So, talked a bit about how I have taken my medical route, but actually I've done most, maybe not all, but a fair amount of my learning about management skills and leadership skills through doing jobs outside of medicine or through doing things outside of medicine, whether that's been through charitable commitments or serving on boards of residents associations. Those challenges, dealing with leaking gutters in the middle of the night or people whose television aerials don't work, who are shouting and screaming at you, they teach you as valuable skills as if you take on a more formal medical management route. So my fourth reflection, after that long preamble telling you about me, is that you do not just have to learn leadership through the roles that you do in medicine. It is completely valid to go and do something completely different, whether it's leading an expedition to the Arctic or it's looking after a group of toddlers over the summer holiday. Whatever it is, those skills can be taught and learned in many different environments, and you shouldn't be ashamed to provide them as examples if you're ever asked of how you have shown leadership skills. And my very, very, very final reflection, so my fifth reflection, is something that was said to me by a fantastic woman who's now working for an organisation called the Health Ombudsman, which is probably something we don't know very much about. As a clinician, I don't think we come across it very much. But it's one of the routes that people can go if they've got complaints or if they want something done about the care that they're receiving in hospitals and in primary care. And she said to me, and I think this is very similar to the quote that George showed from Jack Welch, and in fact something that Aidan said earlier. She asked me a question which I'm going to ask you. How do you judge great leadership? What do you think are the things that make someone a great leader? Anyone want to shout something out? How would you judge a great leader? Would it be their courage? Would it be their... What do you think?
For me, it's generally doctors who, when I see them practicing, make me think that's the kind of doctor I want to be.
So it's inspiration.
The same thing, inspire respect.
Inspire respect. Anyone else?
I think respect both ways. You respect them, they respect you.
Okay, so she said to me she judges great leadership not by what that individual does, but what those who work for them go on and do. In other words, how inspirational, how nurturing that person is how she judges leadership. And I think that's incredibly humbling and actually a really beautiful way of encapsulating leadership and what that means. So my 5 reflections to finish on are: 1, if you're leading, be yourself. Find your way to be the leader you want to be. Do it because you're passionate about something, not because leadership looks sexy or glamorous or exciting. You don't need to be in a position of authority to make a real difference as a leader. You don't need to have a medical leadership role to learn leadership skills. And most importantly, remember that great leaders are people who inspire and nurture others, not just those who do things themselves.